Welcome to This Explainer. Let's just jump right in. I'm part of the medical education team here at Westminster Multispecialty Clinic in Dubai Healthcare City. And today, we're unpacking a highly misunderstood condition that we see all the time in our consultation rooms: frozen shoulder. It's one of those things that can literally derail your daily life, but it really doesn't have to. To give you a clear picture of what's happening inside that joint, we've broken today's explainer down into 6 parts: the quiet, sneaky start, the anatomy of a freeze, the 3 distinct stages, who is most at risk, the paradox of rest, and finally, our specific physiotherapy approach. But before we get into the anatomy, I've got a question for you. And honestly, it's the exact same question that reflects what we hear from almost every single patient walking into our Dubai Healthcare City clinic. Have you been pushing through shoulder stiffness, just kind of assuming it's going to settle on its own? We see this mindset all the time. You figure, oh, I slept on it wrong, or I tweaked it at the gym, and time heals all wounds, right? Well, with this specific condition, time is absolutely not your friend. Let's start with section 1, the quiet, sneaky start. We begin here because this condition rarely announces itself with some huge dramatic injury. There's usually no sudden pop, no massive trauma. It's way more insidious than that. At Westminster Multispecialty Clinic, we see patients who have lived with these subtle, totally manageable early signs for months. It usually starts with just a little mild stiffness when you reach overhead for a shelf. Then, maybe a quick wince of discomfort when you're getting dressed in the morning. Fastening a seatbelt becomes strangely difficult. And then comes the real hallmark sign: pain that actually worsens at night and messes with your sleep. Because these symptoms creep up so slowly, people just naturally assume it'll heal on its own. Which brings us to section 2, the anatomy of a freeze. Let's look under the hood at what's actually going on. So why doesn't it just go away like a normal muscle ache? Well, the medical reality of what's happening beneath the surface is pretty fascinating. The clinical term for a frozen shoulder is called adhesive capsulitis. Notice we didn't mention muscles or tendons there. That's because this is not a soft tissue strain. Your shoulder joint is surrounded by a capsule of connective tissue. And in this condition, that capsule literally thickens, tightens, and forms these thick bands of tissue called adhesions. Your shoulder feels physically locked because structurally it is. The joint capsule itself is shrinking and clamping down like shrink wrap. Moving to section 3, the 3 distinct stages. Left unmanaged, this doesn't just fluctuate randomly. We observe in our clinic that it progresses through a very predictable and, unfortunately, very painful timeline. Timing is literally everything here. First, you have the freezing stage, which lasts for weeks or even months. The pain steadily builds, and your range of motion just slowly disappears. Next up is the frozen stage. The pain might actually settle down a bit here, but the stiffness, it hits its absolute peak. Your daily function is severely restricted. Finally, you hit the thawing stage, where mobility slowly, and I mean painstakingly slowly, returns. Without clinical intervention, this natural, unmanaged cycle can rob you of mobility for anywhere from 1 to 3 agonizing years. And let's be real, 3 years is a long time to live with a locked arm. Let's look at section 4, who is most at risk? Let's break down the demographics. You might be wondering, why me? Why do my capsules suddenly decide to shrink? Well, our team frequently treats women between the ages of 40 and 60. They're significantly more affected than men. We also see it constantly in patients who've recently had their shoulder immobilized. You know, maybe your arm was in a sling for a fracture, or after rotator cuff surgery. Systemic conditions play a huge role too, specifically thyroid issues and cardiovascular conditions. But there is a stark contrast when we look at systemic health, and this is arguably the most important connection to make today. The general population has about a 2 to 5% risk of developing a frozen shoulder. But if you have diabetes, that risk skyrockets to 20 to 30%. Why? Because excess glucose in your system actively affects the collagen inside your joint capsule, making it way more prone to tightening and forming those adhesions we talked about earlier. Now, this specific data point, 12.9%, is especially vital for our community. According to recent health surveys, that is the diabetes prevalence rate right here in Dubai. That means a huge portion of our residents are walking around with a major systemic risk factor for a frozen shoulder without even knowing the 2 conditions are connected. If you're managing diabetes and you feel a twinge of lingering shoulder stiffness, you need to pay very close attention. Let's hit section 5, the paradox of rest. This is a counterintuitive truth and honestly the biggest trap we see our patients fall into.
It's just basic human instinct to protect a joint when it hurts, right? If you sprain your ankle, you stay off it. If you have a normal muscle strain, you rest the joint so the soft tissue can heal. But a frozen shoulder plays by a completely different set of rules. Resting a freezing shoulder actually actively fuels the condition. By not moving it, you're giving that shrinking capsule permission to tighten even more. You're allowing those adhesions to consolidate. Basically, moving less accelerates the freezing process. And let's look at how this snowballs into an even larger problem. When it hurts to reach with your right arm, what do? You start using your left arm for everything. You change how you sleep, how you get dressed. And these compensations might reduce your shoulder pain in the short term, but they create a whole new set of secondary tension and pain in your neck and upper back. Over the months, this compensatory pain becomes a massive issue all on its own, layering even more discomfort right on top of the original problem. Finally, Section 6, our physiotherapy approach. Let's talk about breaking this cycle.
How do we dynamically treat this at Westminster Multispecialty Clinic? Well, our physiotherapy team understands that you absolutely cannot force a frozen shoulder. Instead, we assess exactly where you are in the cycle. If you catch it early, in that freezing stage, our clinical focus is on reducing inflammation and maintaining motion using careful, graduated manual therapy. We don't overload the joint, we just coax it to stay mobile. But if you come to us in the later thawing stages, the treatment shifts completely. At that point, we use progressive stretching and strengthening to restore your full function and mobility. We also factor in your systemic health, like if you're one of our diabetic patients, to perfectly pace your recovery. The results of this targeted approach are exactly why early intervention is so critical. By stepping in with our specialized physiotherapy, we routinely see patients recover their mobility in just 6 to 12 months. Think about that compared to the natural timeline. With the right care, you're completely bypassing that miserable 2 to 3 year unmanaged cycle. You get your life back and your arm back, literally years sooner.
Which brings us to our final question for you today. Are you just waiting out the pain, hoping it's going to magically vanish? Because as we've seen, waiting just allows the shoulder to freeze further. If you're noticing that sneaky, lingering stiffness developing, particularly if it's getting worse instead of better, I want to leave you with this final thought from our team at Westminster Multispecialty Clinic. Don't let it freeze. Don't fall for the paradox of rest. Reach out to our physiotherapy specialists in Dubai Healthcare City today and take control of your mobility. Thanks so much for joining us for this explainer.